For decades, we've used ultrasound to peek inside the human heart. It's an incredible tool. But what if I told you one of the biggest leaps forward wasn't just about getting a clearer picture, but a deeper one? Today, we're jumping into three-dimensional echocardiography, and believe me, it's a technology that is completely changing how we see the heart's structure and function.
So, let's start with a really important question. As medical trainees, we learn to rely on 2D echo every single day, right? But how often do we actually stop and think about what we're not seeing? I mean, are we truly capturing the full picture of this incredibly complex, three-dimensional, constantly moving organ with what is essentially a flat slice? That's the core problem that 3D echo was built to solve.
All right, here's our game plan. First, we're going to unpack the real-world challenges of 2D imaging. Then, we'll see how adding that one crucial dimension just changes everything. We'll talk about getting true, accurate volumes and function. Then, the really cool part, the surgeon's view of heart valves. And finally, we'll take a peek at what's next for this amazing technology.
So first stop, let's really get to the bottom of the fundamental issue here. We are trying to understand a complex 3D structure using, well, flat pictures. And as you can imagine, that creates some pretty significant built-in problems from the get-go.
You know, this slide really gets to the heart of the frustrations we've all felt in the Echo Lab. To get an LV volume with 2D, we have to pretend the ventricle is a perfect bullet shape, which, of course, it never is. We spend so much time fighting not to foreshorten the apex, which can make the ventricle look smaller and the ejection fraction look better than it actually is. That missing third dimension? That's why you and a colleague can measure the same heart and get two different numbers. And we've all been there. That subjective eyeballing of LV function takes years to master, and even then, it's still just an educated guess.
And look, this isn't some new revelation. This quote just drives home the point that the experts in the field have known for a long time, that we needed something better. We needed a more objective, more quantitative method that didn't depend so much on who was holding the probe.
Okay, so if that's the problem, what's the solution? This is where 3D echocardiography makes its grand entrance. And it's not just a small step up, it's a total paradigm shift. We're going from taking flat pictures of the heart to actually capturing the heart itself as a whole data set.
So here's the magic. Instead of a single, thin 2D slice, a 3D probe grabs an entire pyramid-shaped chunk of data, all in real time. This means we capture the whole structure all at once. And the best part? We can analyze that volume directly, which means we can finally throw those old, inaccurate geometric models right out the window.
When you put them side by side like this, the difference is just night and day. We're going from a single, flat image to a full data set. We're ditching the geometric guesswork for direct, honest-to-goodness volumetric measurement. We basically eliminate those pesky foreshortening errors. And the bottom line? We get a measurement that is way more accurate and, crucially, way more reproducible.
All right, let's dive into the first huge clinical payoff of this tech, getting numbers for chamber volumes and function that we can actually hang our hats on. I mean, this quote really says it all. The evidence is just overwhelming at this point. When you put 3D echo head-to-head against 2D for checking out the left ventricle, 3D wins every single time. It helps us avoid that classic 2D trap of underestimating volumes and making the heart look healthier than it is. So how do we know it's so much better? Well, you have to test it against the best, right? And in cardiac imaging, the undisputed gold standard is cardiac MRI, or CMR. And study after study shows that 3D echo measurements line up so much better with CMR than 2D ever could. It's really the closest we can get to MRI-level accuracy, but right at the patient's bedside. So why does this matter in the real world for our patients? Well, think about it. You're monitoring a cancer patient on chemo that could damage their heart. A small but real drop in ejection fraction is a huge deal, and 3D can pick that up when 2D might miss it entirely. Or what about tracking a heart as it remodels after a heart attack? And it's a total game changer for the right ventricle, that weird crescent-shaped chamber that's basically impossible to measure accurately with 2D. With 3D, we can finally do it.
Now, let's move on to what I think is the most visually stunning and, frankly, revolutionary application of 3D echo looking at heart valves.
The key phrase here is surgical view. This is huge. For the very first time, we can see the mitral valve, for example, exactly as a surgeon would see it with the chest open. You can see every leaflet, every scallop, every little chordal attachment in its true 3D relationship to everything else. It's like having a live GPS map of the valve anatomy.
This is a perfect example of its power in action.
Take mitral stenosis. With 2D, trying to get that perfect angle to trace the valve area, it's frustrating, and you're often just guessing. With 3D, it's simple. You grab the whole valve in one shot, then you just digitally turn the image on the screen until you're looking straight down the barrel of the stenotic valve, and you trace it. That's it. And the number you get lines up beautifully with what they find in the cath lab.
And this isn't just about getting a better diagnosis anymore. This technology is absolutely essential for guiding the most advanced structural heart procedures we do. You literally cannot safely do a catheter-based mitral valve repair without a 3D transesophageal echo guiding your every move. You can't properly size a new aortic valve for a TAVR procedure. 3D echo is right there in the cath lab and the operating room, acting as the real-time eyes of the interventionist.
So as incredible as 3D echo is, let's be real, it's not perfect. Not yet, anyway. So let's wrap up by taking an honest look at some of its current limitations and where this is all headed.
Okay, so what's the catch? Well, right now the biggest trade-off is usually the frame rate. To get that beautiful, big volume, you sometimes have to sacrifice a little bit of the motion quality. But the future here is so bright. We're moving towards technology that can grab the whole volume in a single heartbeat, which gets rid of any stitching problems. We're seeing AI come in to automate the analysis, and we're even seeing an integration with 3D printing, so a surgeon can hold a perfect model of their patient's heart before they even make an incision. How cool is that?
And this quote just brings it all home, doesn't it? 3D echo is becoming a cornerstone of cardiology because it makes it easier to get the complete picture, it makes our analysis more objective, and it gives us numbers we can actually trust time and time again.
So I'm going to leave you with this final thought. We spent this time talking about how 3D echo gives us better answers to the questions we're already asking. But the real revolution, it might be in the new questions it's going to let us ask. As this becomes the normal, routine way we see the heart, how is it going to change our basic understanding of disease itself? That's the exciting future we are all about to be a part of.